nurse. We have a what? A cranial? Oh, well, I'm the surgeon, so. Oh, the patient is saying what? There's something wrong with their nerves and their arms? Okay. All right, send them in. Let them knock. Come on in. Sit down. Have a seat. Let me see what's going on with you. Okay, I am the neurosurgeon. Okay, I'm just finishing up from another surgery. What's going on with you? Your arms? What's wrong with your arms here? You're not feeling? You don't feel that? Give me a second. I'm going to put some acupressure on your arms. Can you feel this? Not really? What happened exactly? You're not too sure? Alright, let me do an x-ray scan. Let me close the door. Oh, I'm just wearing a mask. When I do surgery or use a laser, I have to wear a mask. I don't want to smell anything. Yeah. Okay. Did something hit your arm or something? When you go like this? Let me see. It's strange. Here, let me give you some privacy for a few seconds. Yeah, let me check on something here. Okay. What's your last four if you're social? Can you tell me slowly? Hold on a second. What is it? Okay. And your last name? Starts with what? Oh. What is it again? Okay. I'm much of a typist. I like the secretary to do it, but I'm doing it here. Okay. All right. All right. I see. You told them you had something going on with your nerves and your arms, both arms, but you're not able to feel anything. Is that what's happening? You said. Okay. So. Okay, let me see what's going on here. Disinfect my hands. We have. Oh. Okay. All right. I'm gonna inject, and this is gonna pierce the skin. It's like a mild shock. It's gonna go on your nerve, so you don't feel no pain. Okay. Ready? Okay, and then the opposite that one. Did you want a privacy shield? Or do you want to? No? Okay. You sure? Okay. It's up to you. All right. I have to see what's going on. We'll have to, so making a drawing, model A. See what's going on in your arm. I'll see if there's a minor adjustment. Okay. All right. You'll be using a laser. Oh, wait a second. Before I use the laser, I gotta clamp. Okay. All right. Let's working on the arm. So you don't feel nothing here, right? You don't feel that? All right. Cutting into your left arm with a laser. Making the incision now. Okay. Can you feel anything now? Not too sure. Okay. Gonna pop something inside there. Do you know what your code is? Oh, that's it? Okay. Because when we do surgery, there's a special code. Okay, I'm going to put this in your arm. You should be able to feel this. You feel that? Oh. We'll have to stitch that up. Okay. Do the same thing on the right side. Cutting an incision, not a ruler incision. You feel it? You actually have some skin tags on your skin. Are you aware of that? I can get them off for you. You want me to get them off? Okay. Give me a second here. gonna have to put this up for a while because I don't want them to hit your eyes, okay? Around so, okay, good. That's not for your own protection. All right, let me remove these skin tags from your skin. Okay, how you doing? Okay? I'm almost done. I removed the skin tags. Yeah, we have to use a laser. There's no other way of getting around this stuff. I mean, we can cut with scissors, but... Okay, you're done. Let me bandage you up. Bandages have to stay up for a couple of days, okay? All right, great. You had several of those skin tags on you. Don't worry, they're off. There's a way to keep them off, but you need to talk to we have one here. The dermatologist handles that. Okay, put your bandage on there. All right. And you run around the hand here. Okay. Do you have any questions or anything for me? Oh, we're done. Yeah. Okay, so what's gonna happen now is we have to wait your bandage up, so you won't be able to use your arms. You'll be like this because all this is exposed. We'll give you stitches, but I just bandage you up for now. You'll be able to feel your arms again. So you had some blockages there, so I removed the blockages. Okay. Yep. All right. Okay, cool. All right. Any questions? None? Okay, time for you to go.